All right, well, thank you everyone for being here for our third installment of the Public Health Federal Government Industry Day. Today, I'm very excited to be able to share with you representatives from the Commission Corps of the U.S. Public Health Service. If you're not familiar with the Commission Corps, I kind of look at them as, my always understanding is they are part of the kind of military branches that kind of go on and things like that. But it's work that's really dedicated to public health, dedicated to working at various levels of government, working with populations. So we're very excited to have our guest here today to not only talk about the Commission Corps, talk about their experience, and then we'll leave some time for some questions that I prepared, but more importantly for you to ask your questions of them as well. And so with that, I will pass it over to Commander Percy Laurie.
Okay. Do you have the slide up?
Yep.
Okay.
Let me bring it up right now.
Great. And can you hear me okay? Okay, great. All right. So hello, everyone. I'm Captain Antoinette Percy Laurie, a health scientist administrator at the National Institutes of Health in Bethesda, Maryland, not too far from Baltimore. And I serve as a health services officer in the U.S. Public Health Service Commission Corps, also known as PHS or the Corps. So I'll be using those words interchangeably today throughout the presentation. So thanks for inviting us here to Industry Day. It's nice to see students here, some of you, many names here, and some of you may be here to learn about the service, to see what we're all about. And some of you are here because maybe you feel you're answering a call, that this is your future calling and you need to find out what are some next steps. Well, the Corps looks for public health professionals who need a career beyond the standard clinical or research practice. And we need individuals interested in working to promote, protect, and advance the health of the nation. So that's our call as a service. And I hope that I'm able to provide enough details for you today to understand our purpose and hopefully your purpose. Next slide. So I'll start today by describing who we are, why we exist, and what we do. And I'll also introduce you to two officers, Lieutenant Commanders Lindsay and Biso Sahong, who are alumni of Johns Hopkins. Their experiences, in addition to my own, can give you a good idea of what you might achieve personally and professionally as a PHS officer. Next slide. I do imagine that some of you are hearing about PHS for the first time, so I'll begin explaining who we are. Next slide. So we are one of 8 uniformed services in the U.S. The first 5 you see here, you're probably more familiar with. They make up the armed forces, the military, PHS and NOAA, which is a National Oceanic and Atmospheric Administration. We're the only services with commissioned officers only. We don't have enlisted in our service. And we're not a part of the armed forces. Next slide. Oh, and I didn't realize I had that, but so the Surgeon General oversees the Corps, right? He's America's chief health educator, responsible for giving Americans the best scientific information available to improve health. He is appointed by the U.S. President of the United States with the advice and consent of the Senate, and he's appointed for a 4-year term. And right now, Dr. Vice Admiral Vivek Murthy is the Surgeon General of the U.S. Next. So the officers, we are an elite team of more than 6,000 well-trained, highly qualified public health professionals. We are dedicated to delivering the nation's public health promotion and disease prevention programs and advancing public health science. Next slide. Originally, the Corps was composed only of physicians. However, as the scope of public health has grown over time, so has the variety of professionals needed to carry out the Corps responsibilities. So today, we have a number of professions involved in public health that are a part of the Corps. Next slide. So within the Corps are professional committees and advisory groups that advise the Surgeon General. And today we're representing the Public Health Professional Group, PAG, as they're called, within the Health Services Officer Professional Advisory Committee. And I chair the recruitment and retention subgroup within within the PAG. Should you join PHS in the future and public health is your qualifying degree, I recommend that you do join the Public Health PAG for resources and support as they relate to the Corps. There are other PAGs, as I mentioned, so there are physician PAGs, nursing PAGs, social work PAGs. If those are your qualifying degrees, then yes, I advise you to join those instead. Next slide. So this is just showing you what we do in the PAG and various subgroups and teams that are within the PAG. And at the very bottom, if you can see the tiny print, it mentions the recruitment and retention subgroup, which is, again, this is the group that I chair. Next slide. Next slide. So the mission of the Corps is to protect, promote, and advance the public health and safety of our nation. And we pursue our mission through rapid and effective response to public health needs, leadership and excellence in public health practices, and advancement of public health science. And this has been the public health's mission and method since 1798, a long time ago, when John Adams, the second president, signed into law the Act for the Relief of the Sick and Disabled Seamen. Next slide. So a little bit of history. The earliest predecessor of the Commission Corps was the Marine Hospital Service. And at that time, which was the early 1800s, our country relied on healthy merchant marine for trade and security. So our seamen traveled widely. Often they became ill, brought those sicknesses back home, which made the healthcare a federal concern, right? Their healthcare a federal concern. So the Marine Hospital Service eventually grew into the U.S. Public Health and Marine Hospital Service. And then in 1912, Congress shortened the name to U.S. Public Health Service. The responsibilities of the Public Health Service also changed as new threats to our country's public health emerged. Congress charged the PHS to carry out the medical inspection of arriving immigrants, such as those landing in Ellis Island in New York. And Congress also charged the service with preventing the introduction and spread of major epidemic like smallpox and yellow fever and cholera. And to meet this responsibility, the service had to take over national quarantine, disinfection, and immunization functions. So today's Corps, we work abroad as well as in the US, right? And we help to prevent the spread of infections and communicable diseases. And new threats to our public health, such as SARS and avian flu and COVID-19, continue to develop. So that's just a brief history of the Corps. Next slide. Okay. So for more than 200 years, the PHS has been our nation's front line against the spread of disease from sailors returning from foreign ports, from immigrants entering the country, and from health threats posed by national and man-made disasters. So we continue the battle for better public health today and on multiple fronts. So the officers are involved in disease control and prevention, biomedical research, regulation of food and drugs, mental health, and a lot more that you see on this list. Next slide. So increasingly, the Corps is being recognized for their broad public health expertise. Its officers can provide in response to emergency and humanitarian needs, both here and in the US, both here in the US and abroad. So the last 5 years, for example, teams of officers successfully completed these highly visible and sensitive missions that you see here. We had hurricanes like Irma, Dorian, and recently Ian. We support the unaccompanied children at the border. We've recently done the Operations Allies Welcome, which refugees, helping refugees, most recently Afghanistan, Venezuela, and others. And then, of course, the COVID-19 mission is ongoing for mitigation and vaccination efforts. So those are some things I wanted to highlight. Next slide. So Commission Corps officers, good, thank you. Commission Corps officers serve throughout the U.S. Department of Health and Human Services, and also with some federal agencies outside of the department. So that's what we do, and these are where. Officers may apply to any variety of those agencies that are involved in public health. As you see here, CDC, FDA, Indian Health Service, the National Institutes of Health, the Bureau of Prisons, just to name a few that's on this list. This slide shows a selection of some of those agencies that employ us, and whatever your particular interests, the chances are that you can pursue a career as a Commission Corps officer. Next slide. There are hundreds of duty stations in which officers serve across the country and around the world. And the federal agencies I just talked about have offices in many of the locations that you see here. So again, you can probably find a place in the Corps that suits you anywhere. Next slide. Okay, some student opportunities. Okay, before I go on with the Commission Corps, I wanted to point out these exciting options for students. The junior and senior co-step, you can serve in those health-related fields, various health-related fields rather, to work during your school breaks. Co-step stands for Commission Corps Officer Student Training and Extern Program. Both programs you see here are highly competitive, and applications are on the USPHS.gov website. And they're usually due around August, September, before the student begins their final year of school. And both programs offer excellent benefits, many of which are the same as being a Commission Corps officer. And you'll hear more about benefits a little bit later. Next slide. We also have our Ready Reserves. They're a part of our PHS health responders, and they were signed into law 2020, actually, under the COVID CARES Act. The Ready Corps was signed into law. And so when you look at that, you know, civilians, there are civilians who commit to serving in uniform part-time. They support the Corps capacity. You know, trained and ready personnel fill critical public health needs, such as offer a flexible opportunity to serve for mission-driven clinical and public health professionals who cannot commit a full-time active duty. So this is not a full-time position, but it's definitely important and definitely needed. And again, more information is on our website concerning the Ready Reserve. Next slide. So a highly rewarding professional career is just one of the benefits of serving as an officer in the Corps. As a career choice, we have never looked better, where we offer competitive salary, competitive starting pay that increases with promotions and years of service. We offer healthcare and dental care at no cost. 30 days of vacation beginning your first year, and paid sick and maternity leave. Next slide. We also receive malpractice insurance and some good retirement benefits. Next slide. In addition, we have access to military-based lodging and recreational facilities. military-based grocery and department stores, paid moving and travel expenses related to your job. Also travel on military aircrafts for free if there's space available. I know because I've done it several times. I've traveled to Europe and certain parts of the US on military aircraft for free. It's called Space A. There's discount on retail items in stores and on airlines and airline baggages. I know I've benefited from them all. Tuition and long-term training opportunities are available. I've benefited from that as well. And veterans benefits. Next slide. Okay, so what we have to offer the Corps. So requirements. At the beginning, I stated that we were elite team of highly trained professionals, but not everyone is qualified to serve. All officers must meet several basic qualifications. You must be a US citizen, less than 24 years of age, and pass a physical evaluation. And in most cases, master's is a minimum requirement. Next slide. Okay. So my career, so we're going on to talk about our personal experiences now, and I'll just briefly say that my career has been rewarding in the Corps. I have chaired or co-chaired committees and subgroups for epidemiology, for recruitment and retention, as I mentioned previously, for mentoring, community outreach and communications. And I even sing with the PHS chorale. There is a chorale that performs throughout the year at various meetings and conferences and promotions and so forth. I'm very active in the Corps, as you can see. I graduated from the University of Alabama in Birmingham with my master's, and from Morgan State University with my DRPH. I joined the Corps in 2008, and so that's over 14 years. My qualifying degree was a master's of science in public health at the time. I worked at the National Cancer Institute for 12 of those 14 years, and now I'm at the National Institute on Minority Health and Health Disparities. After I joined the Corps, I went back to school. I returned to school for my DRPH, as I mentioned before, and the Public Health Service paid for that, and I completed that in 2015. I have been deployed a few times. Most have been local within DC and Maryland, mainly for hurricane disasters. But I wanted to highlight these two, excuse me, the nursing home. When the pandemic started, nursing homes were hit the hardest. And so I was sent to another state to assess, along with a team, another team of officers, to assess and evaluate nursing homes for the cause of transmission, high transmission, and to provide some public health education. And then last year I was stationed at Maryland Emergency Management and the Maryland Department of Health to help manage the distribution of vaccines and be the liaison between HHS and the state of Maryland. So that was very unique and important opportunity for me that I was happy to be deployed to help. Next slide. So now I'd like to introduce you to two commissioned Corps officers. Their careers will give you an idea of the incredible and varied opportunities presented by the Corps. So we have here Lieutenant Commander Matthew Lindsay. Next slide. We have Lieutenant Commander Kimberly Biso Hong. And next slide. And so just in conclusion, before passing the mic over to them, again, I want to thank you for coming to our session. The Corps may be the right professional choice for you if you want to go beyond a typical professional practice, if you want to use your professional training in new and challenging situations, if you want to improve the nation's public health and serve your country, this may be the service for you, and perhaps will one day answer the call for you. So as a last word, this Corps is an organization where professional commitment and patriotism come together. So if you are needing more information, you can call or visit www.uspHS.gov, which is the preferred way of getting in touch with us, is going through the website. So I will pass the mic over to the commanders who are alumni of Hopkins, and we can take your questions. Thank you.
Thank you, Captain. I appreciate that. And I'll cycle back to the little bios of Lieutenant Commander Lindsay, Lieutenant Commander Bisong, and just let them both introduce themselves, talk a little bit about what their career path has been, and then I have some questions to ask both of them. So Matt, I'll start with you.
Great, thank you, Paul, and thank you, Captain. And I appreciate the invitation. This is great to be back. I'll tell you that I'm a nurse, and that was my qualifying degree. My BSN actually was the degree that enabled me to be an officer. I did go back to school, not as a PHS officer, but prior to applying for the MSN MPH, and it was excellent. I can talk more about my coursework and my concentration and how that's really helped me as an officer in my current role. You see a picture here of me in Alaska. That was in Anchorage back in 2020. And we could talk more about deployments because that's exciting too.
Hi, everyone. My name is Lieutenant Commander Kim Bisohong, and my qualifying degree is MPH. So I graduated from Hopkins in 2014, and when I was at Hopkins, it was part-time. So I was working as a civilian at the Food and Drug Administration. And from there, after I finished, commissioned over to Public Health Service. And so my concentration was policy for my MPH, but I also did I went for the global certificate as well. In part, my work when I was a civilian at that time at FDA was in the Office of International Programs. So thank you.
Great, thank you so much. So I do have some questions here for the officers to answer for us, but feel free to also, if you have a question, to put into the chat. I'll keep an eye on that to see if there's anything here that I can have them answer for you. So what I'll start with is just a quick question about kind of career trajectory or career path is, and I'm going to choose this top one right here. Tell us more about your career trajectory and about your work in the federal government. So whether it was that you were in it already or you got to it later on, but just kind of share a little bit about that kind of career path and trajectory, knowing that oftentimes careers in public health are nonlinear. They're never kind of a straight line. So whoever would like to start with answering that one, be happy to hear from you.
Do you want to take it, Lieutenant Commander, and then I can follow up?
Sure, that works. I'll say when I graduated my undergrad, I started working I was a contractor for NIH, and my first supervisor was a commissioned officer. So he kind of encouraged me to go back to school and kind of introduced me to the Corps. I, from a contractor, became a full-time federal employee. I started as a contractor at NIH, became a full-time federal employee at FDA. And then from there, that's when I, as I mentioned earlier, kind of worked full-time and went to Hopkins part-time. And then I guess I always had it in my mind that I would join at some point. So that's what I did. And I would say networking is key, and I think this platform is great to expose folks to the uniform services such as PHS, So kind of having this platform or having someone is very helpful.
Yeah, and I can say that I graduated in 2013 and thought that I would be working as an occupational health nurse. That was what I had been studying, was my concentration, environmental and occupational health, and ended up instead taking a position at Sidney Kimmel, right there at the East Baltimore campus, the School of Medicine, working on lung, head and neck oncology clinical drug trials. So that was an incredible transition from being a student using my epi and biostats education and working with patients, using my nursing license. It was a great opportunity, but still, I really wanted to get into the federal government. So fortunately, my work at the School of Medicine at Sidney Kimmel was a great stepping stone to NIH. And I applied to a position with the National Heart, Lung, and Blood Institute because there wasn't an NCI research nurse opening at the time. I didn't get even an interview with NHLBI, but a nurse manager from NCI, National Cancer Institute, contacted me. It took time. Patience is important, right? This was several months of back and forth and phone calls and some emails, but that triggered an interview, and I started at NIH in 2017. And 6 months later, I applied to PHS, but didn't commission until 2019. So again, patience. It took time, but as long as you have a goal and the will and the drive, it's all been worth it.
Yeah, and I think we've already heard that today from a couple of our other organizations and representatives that spoke, is the idea of being very patient with anything in the federal government or an agency or anything like that. It does take time. It's not a reflection on qualifications or anything like that, but it's very much just the nature of the work. So, having the long-term kind of in mind with this is probably the most important thing to do. So, all right, let me go to our next question. So, talking a little bit about, the advantages, disadvantages of the different types of things to do in federal government, I would like to hear from both of you, and is to say what is it that you like about the work to do in federal government, and also maybe the alternatively what you don't like, and just knowing that this is work that's unique, it's different, it's not necessarily one that really has maybe even like a day-to-day thing that's the same. So just would love to hear what you both think about likes and dislikes of work in the public sector.
Sure. I will say I felt the calling to serve others. It's a great way to do so. And, just the mission really resonates with me. With the FDA, also the mission is protecting the public health. And right now I am a regulatory officer in the Center for Blood. Center for Biologics Research and Review, and then within that, the Office of Blood. And so really every day being part of a review team to ensure that products that are on the market, whether it's source plasma, a new device, is safe for the public. So just knowing that you're doing that meaningful work is what I enjoy. And what I like the least, well, I would say if you are a free spirit, then maybe the federal government, you might not quite fit in the box because things are pretty structured and, there's processes and of course the B word bureaucracy. But you know, you learn how to maneuver through that. So I'll stop there. Thanks.
Yeah, I can echo a lot of those same sentiments. I remember getting goosebumps when I first learned about AmeriCorps, and then the same thing when I was applying to and served in the Peace Corps. This kind of, it's like this almost visceral, like you just like this calls to me, this appeals to me. And the same thing when I heard a presentation about the Public Health Service, said this is more than just a typical job where you punch the clock, work, go home, have your weekends. We really are making a big influence for the communities, the nation. It's an excellent opportunity because you work for a federal agency and serve in that agency at NIH. I now work on brain and spine tumor research. They're very rare tumors, but just connecting with the families and the patients who sometimes come to NIH out of pure altruism. They have received all the treatment available that's standard of care and want to participate in a clinical trial. And so to be the nurse that helps manage those trials. And then the PHS responsibilities on top of that, wear our uniforms to work. And I feel like I'm often educating people, patients, and even in my commute, I get out and fill up my gas tank, and someone notices me and says, what are you in the Navy? And it's an opportunity to talk about PHS. These roles, though, can be overwhelming. I will admit to that, because in PHS there are a lot of competing responsibilities, and so it really does feel like, for me, I have two jobs, and that I have things to do for NIH responsibilities and PHS responsibilities. Some of that blends into my evenings or weekends, but I don't think I'd have it any other way. I like to stay busy and I like to be active, so it's a good fit for me.
Great. Captain, I want to make sure that you get a chance if there's anything you would like to add to any of the questions that are asked. So please feel free to interject at any point that you would like.
Yeah, I like what I'm hearing, and I echo everything that I'm hearing. And going back to what Lieutenant Commander Lindsay mentioned about the uniform, that's how my interest was piqued in joining, was seeing an officer. I was a civil service. I was a contractor, then civil service, and I saw a couple of folks walking in the uniform, weekly, and it was, it piqued my interest, and that's how I learned about it. So, for me, what I love working, what I like most about working for the government is the trans NIH work. I'm able to collaborate with a lot of institutes. I love collaborating and networking, and I'm always assigned to lead projects that involve several institutes within NIH. So I love that, and I love learning from expertise, from experts in the field, brilliant minds, brilliant scientists, leveraging my own skills from one agency to build capacity in another agency. That's something that I really enjoy. But going back to what Lieutenant Commander Biso Hong mentioned, there are lots of policies and procedures and bureaucracy, and that's something that it takes time to kind of understand that goes with the territory of working for the federal government, and I think you even said this, Paul, that things take a long time to for you to achieve certain projects and activities that you're wanting to do. Sometimes it takes a longer time than you would like, and it can get frustrating, but it works out in the end.
So I do want to add, there's a question here in the chat from Patrick. His question is inter-service transfer available? He's currently a physician in the Air Force.
Okay, so yeah, there are a lot of services or folks that were once in other services that are now a part of PHS. But you do have to go through the process the same as everyone else in terms of applying. But your service time rolls over into T&E, training and education. So you do get that roll over once you join. So that's a good benefit. Go for it. If you're interested, apply. That's what I say.
Excellent, thank you. Okay. Let's see, let me move around a little bit here. Let's see. Let's go. I'm going to go to this second question that's here, and this is, give us your take on how the COVID-19, which has had such a huge impact in the thinking about public health work that's done, just everything that goes with it. But what is it that you've seen that maybe has either changed in government from the time that you've been there, or the assignments that you had to go on that were kind of dealing with that? So just sharing your perspective about how public health work has or how COVID-19 has impacted the work.
I would say an obvious one was just the work at home. I would say at my duty station, I already had that I could work from home a couple days a week, but then going full time and still making sure things run smoothly. And my office was extremely busy because we were looking at convalescent plasma, accepting INDs, research to see if that was a successful treatment against COVID-19. So we were getting lots of investigational new drug applications throughout the country and different institutions. And as a PHS officer, what makes you different from your civilians colleagues a lot of times is that technically you're 24/7. So when there is a need, you might have to work extra hours on the weekends. It's the common knowledge, like your supervisor is not going to burn you out, but if there is a special project, then you need to commit to those times. So it was extremely busy, but at the same time, it was rewarding because I knew we were doing important work, and it was important that these institutions were able to carry out the research as we were all looking for effective treatments. And so that was kind of a change. And I think I'll just leave it there. I mean, you can say one thing our office does, we have a few folks that go on inspections to different centers to make sure they're, the blood supply is safe. So they go to different blood centers throughout the country. Obviously, there was no traveling at that time, so there's a modification from doing in-person inspections to doing what was called more administrative, where firms had to provide more background paperwork, data to show that they were in compliance. So it was definitely some adapt. We had to adapt, but made it work.
Great, thank you.
Yeah, and I'll say that with the brain and spine tumor population, those patients that were receiving chemotherapy or immunotherapy on an active trial or being referred to us to consider a trial, we had to put them on hold in the beginning of the pandemic, and then throughout 2020 into 2021, and slowly bring patients back. NIH has really led the way in setting a standard for employee health, I believe, making sure symptoms are reported through a text app, and we assembled a large vaccine clinic that I helped work at first for 3 weeks, and then I went back for another 4 weeks where I was vaccinating staff, which is incredible, meeting employees, other PHS officers I had never met before, interacting with different folks from all institutes. And my department really had to examine what work we had been doing on site and what could be done remotely. And this has now resulted in me coming to campus 1 day a week. I come to NIH, to Bethesda. I'm here today. It's every Thursday I come and see patients in clinic, outpatient clinic basis. The rest of the week I'm working from home, and I have a nice little office set up, and it is zero commute. So that's one of the silver linings of the pandemic for me.
Got it.
And I wanted to add that, you know, one of the big things that was highlighted with COVID was the health equities among various groups within the US. And so, you know, with that, that created that impacted the work that we do at NIH. There were many funding opportunities that were created with a focus on minority health and health disparities going forward for COVID and other health issues. And so that's another change in the federal government. There are currently a lot of programs and projects that involve the community as it relates to misinformation, mistrust, miscommunication, and also to increase uptake of the vaccine. So that also came out of so COVID-19 has impacted us in that way as well. So I wanted to bring that out.
Great, thank you. All right, let's see. I think go. So I'm very big about always trying to get kind of, you know, strong perspectives on the things that we can tell many of our students that are important to kind of be aware of. So, and I guess I want to kind of touch on is, you know, knowing that all of you have had, you know, a number of years within the public sector doing work in federal government. What are some of the tips or pointers that you would give for anybody who's looking for jobs there, or you know, your kind of best piece of advice for a student that is looking to transition from being a student and going into some sort of federal government work?
I'm gonna go back to that word of patience.
Sure.
That's gonna be key. You can take the route possibly that I did, you know, becoming a contractor at first, just to get your foot in the door. Then you kind of can look around and see how things are set up and organized, and then you'll have a better idea when you're within the federal government where you would want to possibly apply and transition to become a federal government employee officially. So it might take some time, and also just networking, like I was saying earlier, that's going to be key. And USA Jobs should be your friend. So you would check for new opportunities all the time. You know, sometimes those opportunities are a little vague. So like I said, it's kind of always good to maybe know someone that's working in the agency you're interested in. They can kind of give you more information.
I would say work culture is really important. So to piggyback off of the Lieutenant Commander's response, if you maybe know somebody at NIH or FDA or CDC, wherever you are applying, and hoping to ask about that department or about that area, even if it's not someone you're going to work directly next to. But if you move through the application process and you are feeling like this is going to happen, you're have an interview set up. I take these as opportunities to interview the organization as they are interviewing us. I think it's a two-way street, and that, in my opinion, takes the pressure off of you too, because you come into it with an expectation that I want to make sure this is the right fit for me. So doing your homework, doing informational interviews is really helpful. Talking to people that are in those roles, either in the government or a contractor position that's maybe working to support a federal program, that it's all part of that prep work.
I also want to add, because I think many students may not be aware of this, but there's a virtual student federal service. It's now on, you can go, you can access USA Jobs to find that. It used to have its own website, but this was the first year that they kind of joined with USA Jobs. But there are various federal jobs there where students can work for the year, a year long during their school season, the first 2 semesters. And it's a 10 hours a week that you work. It is volunteer service. You do not get paid for it, but you are working 10 hours a week, working with a federal agency, connecting, networking, doing work. So you're building your CV. So that's one way. You can also apply as a fellow to any of the agencies, as Lieutenant Commander Lindsay mentioned, find someone who works in a particular agency and connect with them and network with them. Also, Lieutenant Commander Biso Hong mentioned being a contractor. Many times you're a contractor, it's temporary, it may last 2 years. And it's very ideal that you will roll into civil service. Many times folks who are contractors are brought in, are hired permanently because they work so well with the agency or with their particular supervisor. So that's another way that's easier to get into the government. And then there are summer intern programs. I know NIH has the SIP program, a summer internship program for students. So it's all these are competitive, of course, but it's good to get your resume and your applications out there and see what happens.
Could you mention again, it's a virtual volunteer service? Is that what
Virtual Student Federal Service, VSFS, Virtual Student Federal Service. It is, it was created by the State Department. And so various agencies or institutes will go on and post a job for however amount of interns that they would like. I actually did it for the first time this year, and I have 2 interns that are working for me. One is in college and the other is an MPH student, and they're doing a really good job. So
that's great. I'd never heard about that, but I would definitely look into it and see if it's certainly something I can share with our students.
It's usually in the summertime that the applications are around July, that the applications are open, and then the student gets hired starting in September, and it matches the length of time that they're in school for the year.
Great.
Yeah,
great, awesome. So there was a question here from one of our students that she's currently doing a Master's of Science in Health Policy, is interested in joining the Corps, just wanted to know if she would be eligible. So I don't know, would it be helpful if I went back to that eligibility slide?
Yeah, you can. Yeah, if she is under the age of 44, and if she does the health screening, there is a screening online, BMI, weight height requirement, and that's the first screening, right? The age and your weight requirement online, and then after that, they do a whole health application, physical and other parts of the application. But that's the first step. The first step is to be a public health student, which you are. So that sounds that you're on the right track so far. But again, the age and citizenship and being medically qualified, those are like the biggest qualifications.
And Captain, I just want to add, so I know MPH for sure is a qualifying degree, and I think they were looking to see if the MSPH would also qualify. I don't know where
that's what I have. I currently have a master's. It's the same MPH. It's Master's of Science in Public Health, means that you did more research. In that, MSPH involves more research, and the MPH is more practice. So it's still a public health, Master of Public Health.
Great, thanks. So I know we only have a few minutes left, and I kind of want to, you know, I would say wrap up our conversation with a, I think more of an understanding of, and I think all of you kind of mentioned it in terms of the uniform gets you noticed, basically. But I'm curious to kind of say, is like, what would be your pitch to somebody that has a call to serve, or they feel like that they want to serve, but that what would be the one kind of pitch that you would give them to kind of let them know that the Corps would be a great way to kind of blend together two passions, protecting the public health of the nation and things like that.
I can take it unless you want to go. You're
Go
okay.
ahead first. I'll follow you.
Okay. So I am on a mission to become a nurse farmer, which may sound kind of funny, but we talk about working in silos in public health, and I work in oncology now, but one of the greatest opportunities in the public health service is to transfer to a different position, another institute at NIH, another agency altogether, and really work in an area that you absolutely care about. And for me, that's the food system. Oncology is still very important. I don't want to neglect the support that I've had, and I really enjoy my position. But in the future, I'm back now part-time as a Hopkins student in the DRPH. The GI Bill is paying for my degree. It's going to be a couple of years before I graduate. I'm just the second year, but I'm specifically studying the food system and how I can work as a nurse and a farmer to possibly do this type of work, either in prevention, public policy, and program management, but not so focused in oncology clinical trials. So PHS has afforded me the ability to start making my way into a different part of public health. And I think if you don't get hired into what you want to do for the rest of your life, which is never something that happens to any one of us, right? We change our minds, our goals shift. It's a great place to be able to have that freedom.
Great. Go ahead.
I would add, if maybe you're a similar personality as me, desk work, because when you're in a regulatory agency, I would say a lot of times it's desk work. There are investigators. I myself don't want to be an investigator at this time. But yeah, if you're looking for something that balances more of being at a desk and then hands-on, because I knew from a public health standpoint, I was like, I want to do some hands-on public health work, but maybe not like, I don't want to be a clinician where that's like my higher focus. So this was a good balance. And when, I've been deployed 3 times, and all 3 times have been very rewarding. Like you really feel like, hey, I helped this vulnerable population, or I was able to help this nonprofit save millions of dollars, because depending on what deployments can be like anything. But I would say I've always found them, although they could be various things, a rewarding experience.
Right. And I echo what was just said. And for me, deployment has been very important, to be in touch with the community, because I don't get to do that in my day-to-day job. I'm providing leadership, but just providing leadership to grantees, which is great, able to see the work that they're doing and guide them and inform them about emerging issues and where the government would like to spend their money, where to focus their research. But it's also good to get to go into the community various times during the year and connect with the community and see what the work that's being done on the ground. So I do like the fact that PHS affords me that, especially with me working for an institute on minority health and health disparities. I'm able to, I feel good about serving my country, improving the health of populations, especially those with health disparities that are socially disadvantaged. So the core focuses on those populations as well. So, yep.
Excellent. Well, again, I want to thank all three of you for participating in this third installment of our Public Health Federal Government Industry Day. I think it's really useful to hear more about the core and what goes on there, what your career paths have been, and kind of to share a better perspective for our students to know kind of what that looks like. So I would say thank you again for your time today. I would like to remind everybody too that we have 2 more sessions after this. So our next one is with the Oak Ridge Institute for Science and Education, about different types of fellowships that they have. And then we'll be ending with a access to expert sessions with 2 alums from the CDC Foundation. So thank you all, and have a great rest of your day.
Thank you for having us.
No problem. Thank you.
Thanks.
Bye-bye.
Bye.